Welcome everyone. It is not Thursday, but it is Tuesday, and we are here with a very special guest, Dr. Uma Katwa from Boston Children's Hospital. He's a Harvard medical doctor. We are super excited about the news that we have to share with you guys today. Before we start, you guys might be thinking what's happening to my face. I have no shame. I have to be on screen no matter what I choose to do. If it's palatal expansion and my teeth are all crooked, well, I had a chemical peel done and my skin is peeling, so I can't pull it off. And I have a filter on, so it's even worse than you guys can see right now. So hang in there with me. Anyways, it has been a couple years since we wanted to do a retreat. And as you guys, as we're saying hello, I'm actually gonna wait for everybody to say hi. And I'm gonna go ahead and share on Facebook while everybody introduces themselves, and then I'll talk about the retreat. Dr. Katwa, go ahead and introduce yourself before we start.
Hi, Renata. My name is Umakant Katwa. I'm the pediatric pulmonary and sleep specialist. I work at Boston Children's. I've been treating children with breathing dysfunction, respiratory issues, and sleep issues. As far as concerned, I treat children with insomnia, to hypersomnia, to sleep apnea. So from babies to young adults. So I'm very passionate about airway and sleep. Thank you for having me.
Of course. Tam, say hi.
Hi, my name is Tamara. I'm a myofunctional therapist. And one of the things that I have done over the years is also become a certified expansion coach for self-healing. So I'll be helping with some of that inner work that we're going to be doing in our retreat. So thanks for having me.
Ta-da! All right, it is shared on Facebook. Now I just have to, I usually tag everyone once a week, only on Thursday. So anyways, I'm going to replay this a few times. I can't look at myself, y'all. I'm going to replace this a few times. So everybody who cannot be here tonight can join us and get the information from the retreat. Something else I wanted to share with you guys. I would like to know who's listening right now. What is your profession and where you are at? So a couple of years ago, I went to this incredible retreat in Mexico. And it was business retreat and personal growth. And there were a bunch of dentists there and me. It was freaking incredible. We grew so much, not only professionally, but also personally. I always say that you cannot grow professionally if you don't grow personally. That's one of the requirements, right? So there's so much inner work that we have to do as healthcare professionals. And if you are a healthcare professional, you're so giving automatically. You are so caring, and we give before we fill our cup most of the time. So the idea of this retreat is for us to fill our own cup so we can keep overflowing into our patients' lives, our family lives, and everybody else who is around us. So about a year ago, Dr. Katwa, we met in a, was it in Brazil?
Yeah.
And then I don't even know how we talked about the retreat. I think you reached out to me and I said, I've been wanting to do this retreat for a while. So we decided to come together. I mean, who does not want to hang out with Dr. Katwa? He is so freaking knowledgeable. Of course, we want to bring Airway into this. So we're going to have some lectures on Airway. And then, do you guys know Dr. Lincoln Harris? He is the CEO of Ripe Global. He is one of the best speakers I have ever seen in my life in terms of knowing how to use the stage and putting his lectures, together. So he's going to come hang out with us also. He's going to be talking about business, about speaking, about his journey, how he became, built a company that's a multi-million-dollar company from being a dentist. And then Tamara is going to help us with our personal growth. We're going to be talking about limiting beliefs and other things that can be preventing us from growing into who we were called to be. So I really want to peel this so bad. I need to stop looking at myself. All right. Anything else I want to share before we start? Okay, I think we're ready. So we're going to start with the presentation by Dr. Katwa. You guys are welcome to ask your questions right here. And we already have, so if you are an Airway Circle graduate, especially the girls who are part of Myo Meets, we already open registration for a very selected group of people, and we already have 4 or 5 seats. I think it's 5 seats now filled. This is going to be a small retreat. We're only going to have about 12 people. So very selective. You have to fill out a Google form. We're going to put the Google form here in the notes. Let me make sure everybody can. Yeah, everyone. Okay. Can chat over here. And we're going to put the form for you guys to fill out. And then if you are one of the selected ones, we will reach out to you. But this is going to be extremely interactive. Before I talk more about the retreat, I'm so excited, guys. Before I talk more about the retreat, I'm going to go ahead and let Dr. Katwa do his thing. Welcome to the Circle stage.
I think this is an important piece. Like, I have been to so many conferences, every time I go, I try to learn, and you're in learning mode. You're not in a healing mode. And more I come back, I feel very exhausted at the end of the conference. Not that I did not learn, just because there's so much happening. You don't get time to hang out with the friends. You're just catching up high and by. You're not able to absorb and assimilate what you learned. And then when you come back, you're catching up on the place where you left, and then trying to recover from all the travel and everything like that. And then next conference comes, and this keep on repeating. So the whole idea of learning was, can we make learning much more fun? Can we consolidate what we learned? You don't need to learn new things every time. What you have already learned, can you better understand what you learned already and try to connect the dots, and also try to heal yourself and try to be supportive. Try to be in an environment where people are learning from each other, because everybody knows a piece of knowledge. Collectively, it is pretty good, but how can we be good at, if not all, most of it, and try to improvise and improve from each other and go back with actually more energy, not like a regular conference, go back and try to, oh my God, I had a conference, I need to catch up with my notes and my patients and things like that. So that what we let, and then as we are trying to learn through this one, I thought airway and sleep related interaction may be good. When also you learn about business, what is that you are missing? You may be knowing a lot of things knowledge-wise, but you may be missing some angle about bringing into the practice, about how to optimize your business. So those are all the things. So there will be a variety of speakers. So what I decided today was, even though it's an airway circle, I will circle around and go back to sleep and talk about sleep. I know what we do impacts our breathing and health. And I'm going to give you a very holistic view of what we are talking about. I'm not here to teach about sleep apnea, how you diagnose sleep apnea, how sleep apnea is important for us, and surgery versus expansion versus myofunction therapy, all the things. But I think you may be a dentist, you may be a myofunction therapist, you may be an ENT surgeon, you may be a physician, or you may be just a chiropractor or anything like that. I think we are dealing with each and every aspect of a body in a way that the other person doesn't deal. When the disease happens, it happens in total. It doesn't happen in pieces. But the approach is very fragmented. They mainly come to me, or they may come to you, or they may not come to both of us. So we are treating a piece of a problem. And here I'm trying to give a global perspective of a problem. So what I'm going to do today is I'm going to share some slides. I'm gonna tell you what you already know. I'm not telling what you don't know. And I will take it from there, and let's see how we can. Let me share the slides. Give me 1 second.
Take your time.
Okay.
This is crazy, because whenever we had some Zoom meetings, every single time he was talking about the ideas for the retreat, I was like, that's exactly what we're looking for. So super, super exciting here.
Okay.
Here you go.
Here are slides. Okay. So let's talk about, why do we sleep? I think sleep is one aspect and a fundamental function of evolution, that we spend 1/3 of our life sleeping. And if sleep was not that essential, I think the entire evolution probably has gotten us wrong. And it is very, very critical that we sleep for overall health, well-being, both from physical, mental, and spiritual, if you want to call it as. But how can breathing and the effect of breathing and sleep and health? So we are talking about breathing, but in fact, I'm actually talking about sleep. So I'm not going to be talking directly about breathing, but I'm going to talk about breathing through sleep. So let's talk about the sleep. So just going back and refreshing your memory, what is sleep? We define sleep in various terms, but if you really want to define sleep, sleep is a state of reduced consciousness. We all know that, where the person or the species become unresponsive to the environment, external environment, and it's a reversible phenomenon. If it's unreversible, you probably, you're in coma, but it has a homeostatic drive. And I think this is the critical piece of understanding about the overall sleep health is the longer you are awake, the more sleepier you become. The longer you sleep, the less sleepier you become. For example, if I'm awake for 16, 17 hours and I sleep, I'm sleepy, but I can easily fall asleep. If I'm awake for 24 hours, if I'm doing a night call, I'm awake for all 24 hours, so I'm very sleepy. And if I continue to be awake for 36 hours, I'm extremely sleepy. And 48 hours, you become very sleepy. And similarly, the longer you are awake, up to 72 or whatever it is, you're awake, you become very sleepy that you barely try to stay awake and you try to, maintain a posture. So in fact, if you don't sleep for more than 6, 7 days at a stretch, completely, you can die, just about a heart attack and die. So it's very, very critical that sleep is important and essential, a function of life. And there's a species specific position. So every organism or animal has a specific position. The one aspect which is very critical is the mammalians, like, the dolphins and whales, and what we call as a hemispheric sleep. So unlike humans have, two hemisphere, right side of the brain and the left side of the brain. In the aquatic evolution of life, when the life was evolving through the oceans and water, when people, like when the species were in water, they could not fall asleep having both the brains fall asleep at the same time. So if with evolution, half of the brain was sleeping and half of the brain was awake. So when the rest, half of the brain is resting, the other half of the brain can function so that these mammals can continue to swim. They can go during migrations from North Pole to South Pole to wherever it is for feeding, whatever it is. And the other half of the brain subsequently sleeps. So this is how evolution has happened. So as evolution went into land, there was no need to have bihemispheric sleep. And so the sleep became much more consolidated into bihemispheric, both the side of your brain sleep. And subsequently, the sleep stages and the sleep timing is determined by the rotation of the Earth on its axis and around the sun. So basically, a day is 24 hours. So when the sun goes down, when it gets dark, it secretes melatonin hormone in your body. You feel sleepy and you fall asleep. When the sun rises, it suppresses the melatonin and you feel awake. So your day and night cycle is consistent with your awake and sleep pattern over a period of time. So now, why sleep is so important to everyone? So it also, in addition to various factors, nobody can pinpoint and say that sleep has the most important function or this is the function. So if you're sleep deprived, you affects your memory. If you're sleep deprived, it affects your immunity. If you're sleep deprived, it can affect your heart. It can affect your blood pressure. It can affect metabolism. It can affect digestion. So it can affect every aspect of health. So in addition to the restoration of the body, I talked about it affects metabolism and immune function. The most important function, which we're going to talk in details in the next few slides, is detoxification or cleansing of the body. So when you're awake, the brain is the most active organ. So because of thinking, reading, listening, talking, or just doing some activity, stimulates the neurons and produces the byproducts. And these byproducts of the neuronal activity accumulate in the brain interstitium or in the neuronal tissue. Those metabolites or impurities, what we call as, needs to be frequently cleaned up. And if they accumulate, obviously it causes issues with the brain, and that depends on the age. It also helps with memory consolidation, which happens during your REM sleep or your dream sleep. And it also helps with the memory retention. For example, you are listening to me today, you're going to listen to this, and then whatever you have heard, and if you have a good night's sleep and you go through a good cycle of sleep without any underlying sleep disorders, It helps to form the things what you learn into memories, into both short-term and long-term memories. So having a good sleep is very, very critical for you to remember and form memories on what you learn. So in spite of people learning frequently, or kids going to school and studying, and if the kid is not getting good quality sleep, where the REM sleep is reduced or fragmented, it can affect your learning, memory, and cognition. Then it also helps to regulate your body functions with the temperature going down in the nadir of the night. At around 3 to 4 a.m., your temperature drops by 1 degree and your blood pressure is the lowest. Your heart rate is the slowest at that time. And it also helps to think abstractly and think and organize and work very. So the next thing what we talk about is what are the stages of sleep? We all talk about the stages of sleep into awake stage is awake, then REM sleep. N1 is the stage 1 sleep, which is a light sleep. N2 is the intermediate sleep, and the N3 is your deep sleep. So when a child sleep or anybody young adult sleep, your first half of the night, you have a lot of N3 sleep. This is very, very important, and that is where you feel very restorative effect of sleep, and the brain cleansing happens during this phase of sleep. And the latter part of the sleep, you have more of a REM sleep, and hence your nightmares are much more common in the latter part of the night. During the latter part of the night, you have more of a memory consolidation. So if the patient wakes up early or unable to sleep for the latter part of the night, affecting their overall REM sleep, those children may struggle with memory or memory consolidation. Similarly, as I talked about, we have a circadian nadir, which is around 3 to 4 o'clock. That's when your cortisol levels are at the lowest, your heart rate is at the lowest, your blood pressure is at the lowest. As we wake up and go through the day, your cortisol levels peak at around early morning, between morning to noon. And as the activity goes on, your heart rate and blood pressure are around peak of your normal variation in the evening. And then after evening, it starts to go down again. This is how your circadian biology works. So one of the important concepts of sleep is brain cleansing. I think we have a lymphatic system in the body. The brain doesn't have a lymphatic system other than the coverings of the brain called meninges. They have the lymphatic system, but the brain tissue itself doesn't have the lymphatic system. It has a system called lymphatic system. It's a glial-based transport and functions similarly to the lymphatic system. So for example, you have a blood vessel here, and around the blood vessel, there is endothelial cells, and there is basal lamina, and then there is this perivascular space here. So this space is the space where you have CSF flowing through around the blood vessels in the perivascular space, and that is the space which is very, very important for cleaning the brain. In that space, your central or the CSF tends to flow. So as I told you, when the brain activity happens, it produces lactates, amyloid beta, and tau proteins. These are the basic biometabolic products of your brain activity. And in Alzheimer's disease, this amyloid beta protein is elevated, and to the point that the brain cannot clean that protein, and that damages the neurons in the brain, and those patients affect memory and ultimately develops Alzheimer's disease or dementia. So it's very, very critical that this functions. So if you really want to see how the system works, is here you see the arterial artery here, and around the artery there is a space called periarterial space, and in that space the CSF flows. And there are veins here, which the artery brings the oxygenated blood from the heart to the brain, and the venous takes the byproduct or deoxygenated blood from the brain back to the heart to send it to the lungs to clean it. So while there is CSF here, and depending on the stage of the sleep, there is seeping of the CSF to the brain tissue, and it cleans up, in a systematic manner. And all these metabolites you see are taken up by the CSF and goes into this, and they go out and go to the heart. And this circulates from artery to the vein side, this flow. And this cleaning depends on the stage of the sleep. For example, you can see this here, the arteries are like this. These are the vein, the blood is going into the vein, the blood is coming, and you can see this through the tissue in the brain. You can see the CSF flow happening, and then it accumulates. You take all these black dots, which is the byproducts of the neuronal metabolism. It cleans and takes into the perivenular space, and then it goes and dumps into the heart, and then it is taken and cleaned up from there. So this cleaning mechanism is highest in your deep sleep, your N3 sleep. It's a little bit present in your N2 sleep, but it is very, very minimal, very low in your awake pattern. So the brain cleaning mechanism only happens when you sleep. And you have to have certain type of sleep. It happens in the deep sleep. It doesn't happen in the light sleep or very minimal, or when you're awake, your brain is not cleaning. So when you're awake for much, much longer, the brain continues to accumulate all these metabolites. Hence, you will feel tired. You will feel your memory is not great when you're awake for 24 to 48 hours because your brain is not cleaned or cleansed because with these metabolites. So it's very, very essential that you need to have a day to day or night to night or regular sleep to have the brain activity. So now, how does the brain cleaning and what it depends on? It will be very, very fascinating. And when the more and more I learned about it, I was fascinated that as simple as cleaning in the brain is dependent on how you breathe. So it depends on the route how you breathe, whether you're breathing through the nose or you're breathing through your mouth. It depends on the pattern of breathing, which is the rate you're breathing slowly or you're breathing fast. It depends on the phase of the breathing, whether you're inspiring or exhalation. It depends on the depth of the breathing, either you're taking a deep breath or you're taking a shallow breath. And it also depends on how regularly you're breathing. If your breathing is very irregular, like means because of the obstruction or whatever it is, then the breathing or the cleansing mechanism in the brain is not effective. I will show you how that affects. It also depends on the cardiac pulsations. You have a slow heart rate or you have a regular heart rate or irregular heart rate. It depends on the stage of sleep, which is your happens more in the deep stage. And also your brain cleaning depends on how you sleep. Your brain cleaning is most effective if you sleep on the lateral side. It is least effective when you sleep on your prone position with your stomach down or sometimes on your back position. So brain cleaning activity also depends on what position you sleep. For example, while you are awake, right? We can control the breathing. That is the only thing which we as humans can control. You cannot control your heart rate technically to the extent how you can control your breath, because you can hold your breath, you can breathe fast, you can breathe slow, but similarly, you cannot regulate your heart rate. So hence, yogis and all these people with the breathing mechanism or breathing experts, they say that by having a much more calmer, quieter, slower, and deeper diaphragmatic breathing will help to make your focus, attention better. Even if you can regulate your breathing, it can also help the brain cleaning mechanism while awake to some extent, so that this learned behavior can also help you to have a better breathing or a parasympathetic breathing during sleep. So, but when we sleep, right, our breathing is much more automatic. When you're awake, you have an awake tone, which keeps the airway open. But as soon as you sleep, you lose that awake sensation. You depend on your automatic breathing mechanism. So if you have an airway obstruction, if you have a skeletal abnormality of the facial bones, you have a small jaw, you have a blocked nose, you have big adenoids or big tonsils, it can affect your breathing pattern. So this can cause snoring, and you can see this child here who is breathing has a very paradoxical breathing. Normally, when you breathe, your chest and belly will move together, up and down. But this patient is mouth breathing. This patient is breathing is very irregular. You can see the patient pauses and then has a retraction. So the breathing mechanism is abnormal. The patient is snoring, and the patient is also having increased work of breathing. So this itself can alter your brain cleaning, which is supposed to be happening during sleep. So the nasal breathing versus oral breathing, we talk about a lot of things, right? We all talk about how nasal breathing is important for facial development, how it is important to stimulate the breathing, and blah, blah, blah. We know all those things. But I think one of the most poorly understood importance of the nasal breathing is when you breathe through the nose. I don't know if you know this, through the nose, at the base of the brain, where the roof of the nasopharynx, you can see this olfactory bulb, and these are cribriform plate. This is tiny, a plate, a bony structure with a fenestration, and through that you can see some tiny nerves comes and innervate. So when you breathe first, this is helps with your smell, all those things. So if you breathe through the nose and the air stimulates this olfactory area. This is the first time your brain gets sensation that this person is breathing. And once that happens, it stimulates the brain and causes neuronal oscillations, that the nerve starts firing. And the nerve starts firing in the olfactory area, then it sends signals to your amygdala and hippocampus. And then they get stimulated, and then the entire brain activity tends to rhythmically oscillate. So the more regular your breathing, the more regular the stimulation, the more rhythmic the neuronal oscillations. If you're snoring, if you're having this irregular breathing, the oscillation in the brain can be very, very irregular. If the brain oscillation is irregular, that can affect the brain cleaning mechanism. So having a regular breathing, a quieter breathing, a nasal breathing is extremely important for us to stimulate the neuronal activity in the brain, where the nerves of all the brain start oscillating, and that oscillation is extremely important for your brain cleaning mechanism. And hence, during sleep, if you're mouth breathing, you're bypassing the stimulation of that, so your brain doesn't get signal that you're actually breathing. Then you can snore, you can obstruct the airway, you can have increased sympathetic drive, it reduces the blood flow to the brain, it can ultimately lead to dysregulated brain clearing. And in spite of all the things what you do, even just simple as mouth breathing has been associated with poor cognition and poor memory. Whether you have sleep apnea or not, that is irrelevant. So mouth breathing can affect your brain clearing mechanism. It can affect your sleep consolidation and memory formation. So hence, as simple as brain breathing is a mouth breathing, that will ultimately lead to poor neurocognition and memory consolidation. So it's very, very important. And these kids also tend to have emotional dysregulation on top of that. Hence, and there are studies showing that a completely good kid, and if you completely switch from nasal breathing to oral breathing, it can affect memory and emotions of these patients. And now I was talking about the posture of the lymphatic system. Remember the brain system which cleans? If you're sleeping, and this is the velocity of the cleaning, what's on different body positions, which is prone, lateral, and supine. And you can see the velocity of the cleaning of the lymphatic flow to the brain in the cerebellum, which is the part of the brain on the back side of the brain. This is your hippocampus, which I talked about. This is your midbrain, and this is your orbital frontal cortex in the front part of the brain above the eyes. So these all areas you can see when you're in the lateral position of sleep, the cleaning of the brain mechanism is very quickly and very efficient. So compared to supine position and in your prone position. So the prone position is the worst position for you to sleep as far as the brain cleaning is concerned. If you sleep in your supine, it's better, but your sleep apnea tends to get a little bit worse than that one. But the most efficient way to clean your brain is more on the lateral position, actually. There are studies showing that one. So now if you look at the comparison regarding deep breathing and spontaneous fast breathing on the brain cleaning activity, you can see when you're deep breathing, having deep and slow breathing, you can have the brain waves are very slow and rhythmic, right? This is what happens in your deep sleep. In your deep sleep, when I'm reading sleep study, just looking at the breathing pattern, I can say this patient is already in the deep sleep. I can say the patient is a REM sleep just looking at the breathing pattern. I can identify the sleep stages just looking at the breathing without even looking at the EEG. So that is a signature mark of your each sleep cycle. If you are spontaneously breathing very fast, right, your brain activity also becomes very fast and it can be suppressed at times. So if you're hyperventilating, it can slow down and can be low amplitude brain activity. So when you have a slow rhythmic breathing, you can see the pulsatile clearing of the CSF, and that pulsatile cleaning is extremely important for your brain to be cleaned effectively. If you're spontaneously cleaning, your activity may not be very effective. The pulsatility is lost. And if you compare the cumulative effect of cleaning of the brain in deep breathing versus spontaneous and rapid breathing, the deep breathing cleans the brain much more efficiently and quicker compared to the fast breathing. So it is in our own benefit to help train the patients how to breathe. Not only how to breathe, both during awake and effectively treat their breathing during sleep as well. So slow and deep breathing promotes CSF flow, promotes brain cleansing and brain circulation. It is very, very important for the overall well-being. So if this is hampered, either because you are hyperventilating or you have a sleep apnea or something like that. It can affect the way you feel in the morning, rested or not, the quality of the life. It can affect the aging. If you don't treat that, you can rapidly age. There is studies showing that your brain age can quickly increase on the patient's untreated sleep apnea for a long period of time. It can affect short-term and long-term memories, particularly in learning age group. It can affect the cognition, and some of the changes of cognitions can be permanent in spite of you treating sleep disorder breathing. And ultimately, the risk of dementia and Alzheimer's, I think there's a lot of research coming in this area that if you don't treat your breathing patterns, both awake and sleep, particularly during sleep, and it continues over a period of time, there is a high risk of dementia, and particularly some patients are at high risk of Alzheimer's if you're prone to have Alzheimer's. Because those beta amyloid proteins and tau proteins, which are byproducts of metabolisms, if they are not cleaned, they tend to clog the CSF, they tend to clog the neuronal activity, they tend to neuronal degradation, and ultimately neuronal loss. So because of that, you cannot reproduce those neurons. You cannot clean that. It's completely clogged arteries and clogged brain tissues, and that leads to all this effect on the overall health of a patient. So if this is a video, which this is actually the brain oscillations happening with your normal breathing. So when you're breathing, your brain is actually moving. See how regular this moving is? This is the CSF from here. This is how regularly it is moving. This dark, the white part is the CSF, you can see. And this with the squeezing mechanism, with the regularity of the breathing. And on patients who have sleep disorder breathing, when your breathing is very irregular, this pulsatile motion of the brain can be affected. And because of that, your brain cleaning mechanism can be affected. So it is important that how we breathe, how regularly we breathe is extremely important for us to clean the brain and ultimately have the effect of benefit of sleep in these patients. And this is a patient who is in very stable M3 sleep, where you see the breathing is very regular. I told you, right? When looking at the breathing pattern, without even looking at the EEG, I can say this patient is in the M3 sleep. And this is the stage of sleep when the breathing is so regular, your brain cleaning mechanisms are most effective. And that is extremely important for us to understand. And patients who age after age of 70, 75, 80, your level of N3 sleep reduces. In patients with dementia and Alzheimer's, the N3 sleep is even absent. So there are the blood, like the brain is so clogged with these proteins, they don't even get N3 sleep, so that whatever the cleaning mechanism can work will not be very effective. And there is a lot of research going on to do deep brain stimulations in risk patients and also help facilitate increased N3 sleep by drugs or brain modulations that can actually start cleaning the brain, which can delay the dementia, delay the neurocognitive deficits, and also possibly prevent Alzheimer's in future. So there's a lot of research going on. Just by modulating how you breathe, you can also modulate how you clean your brain. So this is the patient with sleep apnea who is snoring heavily, who has a very irregular breathing. You can see the brain activity is not very stable. You can see a lot of activity, slow activity, lot of activity, slow activity, and this patient is obstructed now, and this patient is sleeping prone. Imagine the children who are sleeping prone because they are not able to sleep supine outside, and they have this bad sleep apnea. This patient came to see me with severe sleep apnea with a severe learning difficulty in the school, and he needed multiple surgeries, including tonsils, adenoids, and lingual tonsillectomy to cure his sleep apnea. And after that, he got better, and within 3 to 4 years, he was able to catch up, but he never got his full potential back. So there are patients what we treat, and the effect of irregular breathing is not only on the breathing to make it better, it ultimately will affect their sleep pattern. And you can see this is a patient with sleep apnea, completely obstructed, and you see how irregular the breathing becomes. You can see this activity here, and you can also see because of the apnea flow, your heart rate is going up and down, your saturation is going up and down, and you can see this patient with saturation in the 50s had a severe sleep apnea, saturation going nearly, each line is an obstruction, so nearly continuous obstruction, lot of desaturations. And these patients with this pattern of irregularity, with this degree of drop in saturations, you can only imagine that how their brain is totally fried, that the brain is, even though brain is sleeping, it does not get the benefit of sleep because it will not be able to clean itself. So hence patients with sleep apnea, even though they sleep 8-9 hours, you can sure that when they wake up, they still suffer with memory issues. They suffer with emotional dysregulations. They suffer with attention. They suffer with cognition. And this is untreated for many, many years. This can predispose to adult OSA, and that's if it's also untreated or partially treated or suboptimally treated, can lead to dementia and other metabolic, cardiometabolic health problems. This is another example of how brain is working at the microscopic level. And you can see this I talked about, like, sometimes we take big breaths, and sometimes the brain, when it is in different stages of sleep, gives you one slow wave rather than multiple slow wave. It gives you one slow wave, and you can see this part is expanded here. So there is one slow wave, and there is an activity in the EEG, and with that, your chest movements increases, and because of the chest movement increases, you take more air into the lung, and as soon as that, there is a vasoconstriction. So that means when your pulse ox, which is on the finger, constrict, there is a peripheral vasoconstriction. So the blood from the periphery is pushed into the brain. So when that happens, the CSF flow in the brain increases, and because of the CSF flow increases, the attenuation of the brain reduces, and then subsequently the brain cleaning increases. So even as simple as a one slow wave in the brain can have a dramatic effect of increasing the CSF, trying to clean the brain activity. So similarly, there are studies already published that changes already happen in the brain, in the region, in the patient with severe sleep apnea. So in patient with severe sleep apnea, if they are left untreated, there are changes in certain areas which affect with memory consolidations, and you go ahead and treat that sleep apnea, and some of the areas of the brain will not fully recover, meaning that you may make the child better in emotions and attention, but cognition is one thing which is dependent on the neuronal activity. If the neurons are reduced or damaged, those neurons may not regenerate. So hence these patients are at high risk of cognitive difficulties which may not completely recover even after undergoing treatment of sleep apnea. Hence, treatment of significant sleep disorder breathing or mouth breathing or snoring is extremely critical in children to make sure that they can be optimized as far as the outcome is concerned. So last few slides. So how does brain breathing affect sleep, right? We know that it affects sleep stability, but breathing, if it's abnormal, it's very, very critical for brain cleaning and overall health and well-being. So health, if your breathing is abnormal, you're breathing very fast, you can age very fast. You can develop dementia or Alzheimer's very fast, and ultimately it leads to poor quality of life. So breathing is the essential factor of life which you can control, and if it's uncontrolled or not treated or even not identified, it can affect every aspect. So sleep can be indirectly affected by the breathing mechanism. So now the airway stability is extremely important for your sleep stability. So if your airway is not stable, it can ultimately lead to poor sleep stability. And you know this consequence of poor sleep we just talked about. So what are the factors which depends on the airway stability? So one is the size of the airway. If the airways are big, they tend to be stable, but not necessarily all the time. It depends on the function of the airway or the critical closing pressure. So if the airways are not functioning properly because the muscles of the airways are not recruiting or recovering from obstruction, it can lead to poor airway stability in spite the size of the airway being bigger. It depends on the tone of the airway. If you have a low tone to begin with, because of various factors, because of the poor diet or lack of breastfeeding or poor craniofacial development, if the tone of the muscles are low, those patients also have unstable breathing or poor stability of the airway. It also depends on the thickness of the muscles of the airway. Because when you are snoring, because of the vibratory trauma, there is a micro damage to the muscles, and these muscles over a period of time can degenerate. And in that degenerated tissue, there can be deposition of the other tissues such as amyloid, or it can also be deposition of the fatty tissues. And this inflammatory tissue does not help in the contraction of the airway. In fact, it leads to unstable airway. So if there is a loss of thickness of the muscles because of inflammation, because of untreated vibrations or poor breathing patterns, those patients may not completely recover in spite of your myofunctional therapy because the muscles have lost the ability to recover. So hence it's very, very important to preserve, meaning start early. If there is inflammation in the airway, inflammation can be because of the snoring and vibratory trauma. Inflammation can be because of the acid reflux. Inflammation can be because of the infections. or allergies, or for the matter, other things, infection. So that can, if you don't treat your airway, if you don't preserve the mucosa of the airway, it can ultimately lead to poor stability of the airway. If there is deposition of the airway, like fat, if you gain weight, if there's a lot of fat tissue deposition, and then the muscles become much more smaller portion of the thickness of the airway, and those airways don't respond well. Some patients are prone to have edema during sleep, particularly when you sleep supine or in any particular position over a period of time, because you're lying down, you're not standing up, because of the gravity effect, there can be accumulation of the edema, and hence you will see over as the night progresses, the severity of the obstruction tends to get worse because your airways are becoming swollen and becoming much narrow through the night. The position of the airway. If your airways are very flexed or your airways have with somebody with the extended neck posture, if your airways are not in a neutral position, they tend to be unstable. Somebody who's not breathing through the nose. A mouth breathing causes inherently unstable airway. It's very, very important. Or if you're breathing through an obstructed nose, it is causing significant airway flow velocity, creating Bernoulli's effect and sucking the tongue at the back of the throat can also lead to significant airway problems. And obviously your craniofacial structure, the way your adenoid faces, small chin, high arch palate, causing a lax airway lead to unstable airway. And your airway stability also depends on awake or sleep, and during sleep, whether it's a REM sleep or non-REM sleep. So there are multiple factors to determine the airway stability. Hence, it is not one thing which is different. So when we approach the airway, when I see the airway, I see all these factors to help you treat the airway. And I think everybody touches a piece of that. And hence, to effectively manage an airway in a patient who has been neglected for a period of time, I think there needs to be a small village which has to take care of them. It's impossible for us to expect we do a surgery and that the airway will heal itself. It absolutely needs much more care than what we think. So the airway management includes remove the obstruction, expand the airway if necessary by surgical or expansion means. You stabilize the airway. Sometimes if you use CPAP to stabilize the airway, weight loss reduction, edema treatment, and all those things. And then ultimately, it's very important to rehabilitate the airway. I think the upper areas are the only muscles which are less rehabilitated compared to the orthopedic and skeletal muscles. So rehabilitation is an extremely important part. And people who rehabilitate have to understand all the factors which can lead to poor rehabilitation. So they have to take care of those factors like edema, adipose tissue, and other things. Otherwise, the rehabilitation itself will be very ineffective. So I think when you see an abnormal breathing pattern while awake or during sleep and a compromised airway, these are the patients who are at a future health risk. It can be slow in some people, it can be rapid in some people, but eventually they get there. So this is an opportunity for us who are working in the pediatric field to identify these patients and help prevent them from becoming future chronic patients. So it's very, very important. I think if you look at obesity, I think I'm just giving an example that there's a lot of, there is a mistypo, it's not FLP, the GLP drugs, the Ozempic like things. So what happens in obesity patients? There are extremely, large patients who have a narrow airway, a lot of fat deposition, the airways get stretched, and you give these injections, and these patients rapidly loses weight over the next 2-3 months. And then they also lose the muscles, the fat in the airway. But the muscles are stretched and the airways are stretched. They are not rehabilitated. So in spite of losing weight in some of the older patients, you may still see that they have an unstable airway. So those airways needs much more rehabilitation. So I think treating obesity patients without airway rehabilitations may lead to partial treatment. So it may give you a short-term benefit, but it may not guarantee the long-term stability of the airway. So this is just one example. I'm talking what we will be facing over the next few years, that there are a lot of obesity drugs recently approved by the FDA, and more patients are going on those ones compared to the previously when we were giving bariatric surgeries before. So those patients needs definitely to be rehabilitated. So I think a future rehabilitation is when we meet in a group or retreat and try to talk about how we can learn from each other. These are the factors I'm trying to make them understand, how you think, how you talk to your other providers, so that everybody's on the same page, so that we have a huge opportunity and responsibility, I think, to identify first, to identify all the factors and subsequently treat and rehabilitate the airway. Thank you.
Wow, wow, wow. You never cease to amaze me. Thank you so, so much. I have heard so much, of the lymphatic system, but never explained it this way. My gosh, who else over here is over the moon? This was wonderful. Thank you so much, Dr. Katwa. Now, can you imagine hanging out with this guy and you get to pick his brain? We have some great questions already. I'm going to go ahead and start with Karen D. Would love to know if there is a general oscillation frequency that indicates health, or if there are different oscillation frequencies associated with healthy function in specific areas of the brain.
So right now, they are not for prime time, so I cannot comment on that. So a lot of people are doing the spectrography of the EEG. So when we do the overnight EEG, that is a great marker of, like, we do a spectrogram and we see what is your delta power, which is a slow brainwave power, and what percentage of your sleep is slow wave sleep. And I also look at the fragmentation index. So, I mean, technically, if you're sleeping 8 hours, you will not have the healthy oscillation all for 8 hours. You don't need that. Your brain needs about 2 to 3 hours of good deep sleep to clean the brain. It doesn't need 8 hours of sleep. But also the other stages of sleeps are important, not for cleaning, but for memory consolidation and neuronal plasticity. So there is not a single oscillation, but what the research has shown at a macroscopic level, not at the microscopic level, which is not for prime time, is that having your great delta power, good N3 sleep, nasal breathing, and having a much more slower respiration. And if you see people who do meditations and yoga, and people who attend that spirituality, they can manage. Most of the people, their respiration, if you go and measure their respiration while awake, they are breathing at a rate of 4 to 5 breaths per minute. Turtle, the tortoise, all these things, they breathe at a rate of 4, and they can live up to 100 years. Right? A dog, which typically panting, is breathing at a rate of like 40, 50 per minute. So they tend to live 10 to 12 years. So you can see, you have already counted number of breaths. So the frequency your oscillation goes up, you're going to reduce your age. If you want to extend aging, anti-aging is breathing. One of the things people try to use on different things for anti-aging mechanisms. So the best thing for you to look young and also at the same time help with your anti-aging journey is having the good quality, regular, good 7 to 8 hours of sleep.
Wow. Wow, wow, wow. Send your questions in, everybody. And I just got a message saying that we have a huge discount for the retreat for doctors. So stay here so I can give you guys the discount code. How does one check if the patient is breathing correctly or not? Is there an objective way to check a person's breathing?
So that's a good point. I think the new technology which will come, there are not many factors to check for breathing. So for example, if a kid is coming to your clinic, it is not the right time to check for breathing because the kid is anxious or the kid is jumping all over the place, and within 5 minutes, you can really not assess that. I think there will be more devices which they can wear, and you can integrate into your iPad with the iPhone. They can come and you can actually say the breathing rate. So right now, what I try to do is, I try to measure the quiet breathing. I try to assess the respiratory rate when they are actually talking to them. But it is a very, what I call it is like a scientific way of doing things. We cannot do a sleep study while awake. It's very, very expensive. I can do a sleep study. I can get some data about sleep breathing, but there are not many good, which are reimbursable at the medical level to test the awake breathing pattern. But I think people are working on that, and we should have that soon.
That's wonderful. Did you guys know that it was a woman that found out about the lymphatic system?
Yes, she's Rochester, yes.
Yes, if a patient has mild sleep apnea, this is from Dr. Lupita Roca. If a patient has mild sleep apnea and uses a CPAP, can he make the muscle lazy and use to the pressure to make them need the CPAP even more?
Great point. That is true for older patients. Typically, I use CPAP very, very less in children. I consider that as a last resort, and most of my patients have either low muscle tone or they are extremely obese. They cannot control that. I think I don't use CPAP for mild sleep apnea. I try to rehabilitate breathing, treat the nasal obstructions. If they need surgery, I say otherwise put them on a myofunctional therapy. So most of the children's, if they're otherwise healthy, I'm talking about otherwise healthy kid, they don't have any problems. If you have mild sleep apnea, I think it's important to treat a site of a blockage, which is mostly the nose. And a lot of people don't think of an expansion or myofunctional therapy. They just do adenodectomy and leave them. Adenodectomy only treats the nasopharynx. It doesn't treat the other part like turbinates and other things. So you need to understand the nose as a whole to treat it. And there is so many things we can treat by, if you just teach the child to breathe nasally, you can actually shrink the turbinates. You don't even need turbinate surgery. So
Wow.
that is very, very critical.
Wow, wow, wow. Oh my goodness. All right. Before we answer any more questions, I'm going to share my screen really quickly with you guys. Let me just make sure that I make this really big. Can everybody see it? So here it is. That is Hilton Head Island in South Carolina. If you guys have not seen it, we are calling this a retreat, transform, connect, and thrive. We know that there's going to be a lot of transformation happening in that setting, and we're super excited for everybody who's going to be there. So here is Dr. Katwa, a little bit about him, what to expect. I'm going to go through the agenda really quickly, and I'll show you guys what we have set for you guys in terms of lectures during the retreat. But that's only going to be a small portion of the retreat. We're going to really focus on nourishing our body and our mind, and then talking a little bit about business and connecting with a multidisciplinary network. You guys have no idea how many businesses may be able to come out of this meeting right here. This is the perfect place for you to build strong relationships, and who knows how far you can get into a business together with somebody that's going to be there. So it's going to be April 10th, 11th, and 12th. That's a Thursday, Friday, and Saturday. Starting on April 10th in the evening, we are going to, here is the house, guys. Look at this. We're going to meet first for snacks, and then we're going to have a fireside chat that night after dinner already with a topic. But look at this house in Hilton Head Island. There is a little bit of room in the house for a few people that want to stay there for an extra charge, but there's a really close by hotel for everybody else. But you guys are just going to be sleeping in the hotel. You're going to be all day long hanging out with us. We have activities from beginning to end. The pool is heated, by the way. It's going to be wonderful. And here you register to attend, so you have to answer some questions. And we also have Dr. Lincoln Harris. He may be joining us in a little bit. There he is. I'm going to bring him over as a panelist so he can turn his camera on and say hi to everybody. Let's see if this is going to work. I'm going to go ahead and open. Oops. Here's how you register. So you just have to fill out this information. And then let's go through the agenda real quick. And Dr. Lincoln, you let me know. Oh, there he goes. Let me know whenever you can turn your camera on. So here's the agenda. Day one. So we arrive on Thursday around 3 to 5 is going to be check-in and refreshments. By the way, we have no alcohol in this retreat. We are going to have some mocktails. 5:30 to 6:30, opening circle and setting intentions for the retreat. 6:30 to 8, we're going to have a welcome dinner with a private chef. From 8 to 9:30, this is our first fireside chat. We're going to be talking about the evolution of airway and sleep health, led by Dr. Uma. We're all going to go to bed early, maybe. And then the next morning, 6:30 a.m., we have a sunrise beach walk, which is optional, but I'm going to force everybody to go. And then 7:30 to 8:30, we have some yoga or guided breath work. And then we're going to have a healthy breakfast, just setting intention for the day. And then we start 9:30 to 11. We have our first workshop. Dr. Uma is going to talk about the comprehensive approaches to pediatric airway health. And we're going to have a little coffee break and snack. And then we're going to share cases. We are encouraging everybody to bring their own cases. We don't want people to just bring their successful cases. We want you guys to bring the tough ones here. Bring the ones that we're all going to grow from, that we're all are going to be able to discuss and learn a lot from. So this is going to be the real world challenges in airway care. Everybody's going to be talking about their cases. Then we have lunch, and in the early afternoon, Dr. Lincoln is going to be talking to us, scaling your practice, strategies for sustainable growth. He's a very successful dentist and now entrepreneur. He has a huge company. He's going to talk a little bit about Rep Global in a second. And then in the afternoon, we have wellness activities. We're going to have pool time, massage, craniosacral vibration. I have a vibration plate, red light therapy. You're going to be able to pick and choose what you'd like to do, but this is a time for you to take care of yourself. Gourmet dinner and then
all at the same
mocktails.
time, are they?
You
Just
may be able
imagining us
to do
having craniosacral therapy in the pool with a red light
maybe
being vibrated.
Who knows? I know that you can do vibration and red light at the same time. So a couple of them you might be able to choose. You just walked in right now, but I've been telling everybody my face is peeling, so don't judge. I did a treatment. Mocktails and music. At nighttime, you guys all know Dr. Uma said, Renata, we have to have music. So we're gonna have fun. Next morning, morning meditation, nature walk, healthy breakfast. Then we're gonna have a panel discussion, the future of multidisciplinary airway care, a little coffee networking break, real world challenges and practices of myofunctional therapy. Angela, Tamara, and I are going to talk a little bit about myo. After lunch, it is Tamara's time, manifestation and personal growth workshop. Dive into the power of manifestation inspired by personal growth workbook and learn strategies to align your mindset and your goals. This is super, super big. I think that all of us here own a business and it takes so much. Zoe, can you please walk away whenever you're looking at me like that? I can't function.
Also, all on call or slay.
Okay, we're all slay, baby. I love you.
Yeah.
But anyways, we all know how important it is for us to set intentions, put dates. If you ask any successful entrepreneur, they kind of have their own workbook, and we're going to be able to share that with you guys. But anyway, so that's more wellness in the afternoon. And then that night, we're going to have another chef prepared nice dinner and our closing circle and celebration to reflect on the retreat's journey. And you guys can leave on Saturday night or Sunday morning. But it's going to be freaking amazing. But Dr. Lincoln, welcome to Airway Circle. How are you?
I'm very good, thank you. I'm learning all about how to look after snow on your driveway.
I've been following you. So if you guys don't know, Dr. Lincoln just moved from Australia to Colorado, and he's really enjoying the snow and Costco. You guys gotta go follow him.
I might be exaggerating slightly for comedic effect, but I'm looking forward to coming and getting everyone revved up. Obviously, I'm sure the biggest sessions will be not the official lectures, but the unofficial lectures. Although when I was sold on this whole idea, there was no talk of mocktails, so I might have to put my speaking fee up.
Yes, we're gonna have some good mocktails. There's an incredible restaurant here in Hilton Head Island in Bluffton, actually, where I live, that makes the best mocktails. You cannot even tell, and they're so delicious. So we're all gonna have fun, but this retreat is, we're huge about health, and I don't think alcohol matches with that very well.
No, I'll behave, I promise.
Everybody's going to behave in this one. It's going to be wonderful. We're so excited for everybody who's going to be there, the opportunity to spend some close time and, building relationships and networking with this group of incredible professionals. Can you tell everybody a little bit about your journey? How did you go from being a dentist in Australia to becoming this huge entrepreneur, business mogul?
It was easy, and if you buy my 90-day course, I'll show you how to get rich quick. No, so I think that it's quite a long story. I think it's probably better to tell after hours, but I grew up in Queensland, which is in the top right corner of Australia where the Great Barrier Reef is. I've lived in a town of 7,000 people for the last 24 years. I've had a practice for 24 years. And when I opened the practice, even though it was in a small, rural, poor area, the goal was that you would get as good a dentistry there as you could get anywhere else in the world. And so that was our vision. But because we live so far from the rest of the world, early on in my career, I started flying to the United States quite often to learn advanced techniques, and then to Europe. And then I fell into Dental Town originally, and I learnt a huge amount of dentistry just by being online because I was so far away. It wasn't easy to get to conferences. And so that sort of led into a career of teaching, because when you go online, as has happened to you, Renata, that people ask you to teach. And then during 2020, we had this moment where everything was shut, and we said, if no one could ever travel again, how would we teach a hands-on skill? And that's when we developed cloud simulation. So we ship simulation kits to the dentist. We train dentists in their office. And we do that because it's more like training a pilot. You want to train them in something that actually looks like the plane that they will learn to fly, not in a hotel with a set of teeth that you can turn around and stick the handpiece through the neck, and then with the different materials and burrs and things. So we started doing it in COVID because we had to, and then we continue doing it because it's just better. So so in restorative dentistry, it's grown into the largest course. We have the largest restorative course in the world now. We teach dentists in 35 countries.
Wow.
And I started raising capital to build new technology. And when you start that, you end up in America. So here I am.
Well, welcome, welcome. We're so excited to have you closer to us now. And I know that you have some Airway in Ripe Global with Dr. Claudia Pinter.
We did. So Claudia started teach. She actually was the original builder of our aligner course that we have at Ripe Global. So we have courses. Our big courses cover 3 main areas, which is restorative. So we take people from single teeth to full mouth rehab, implants, and then with orthodontics, we do aligners, but not just simple aligners, complex aligners that need TADs and MARPIs and all the other things to accomplish their goals. So Claudia built that course for us, and then not long afterwards, she had sort of one of those Airway revolutions and came back from a conference with you, incredibly excited. And
I know we have so many people that were in San Francisco recently are all reaching out to her now. So we're super excited to see how this portion is going to grow. She's doing stuff that not many orthodontists out there are doing. So anyway, that we can share the word about Claudia Pinter and Ripe Global, we are here. You guys are doing incredible. So thank you so much for coming to our retreat with us and being able to share all your knowledge with our group. And now we're going to go to Tamara. I'm going to put you in the hot seat. Are you ready? We have something for you guys to answer. We have a little poll.
I'm not ready, but I'll speak.
I'm going to go ahead and launch the poll if you guys don't mind answering. We have a few questions right here. But Tamara, how did you come about learning a little bit about inner work and personal growth? How did this start?
Long time ago. It wasn't something that I had thought I'd be helping others with, only because I was doing it for myself and I was never talking about it. And as I started learning more and just talking to friends, I decided that I probably should share some of this techniques that I've learned for the last 8, 9, 10 years. I have worked with Jamie Dooley. She's an amazing coach for probably 8 years now. And I have graduated from her, I think she calls it Expansion Coach, Quantum Expansion Coaching Academy. And I had done that a few years ago. I actually just got back from over in Michigan, kind of by you, Dr. Katawa. It was freezing for a retreat that we did there for just the graduates of that program from a few years ago. So I'm excited to share the techniques that I've learned that I use in my daily practices that hopefully can help everybody as well. I know, Renata, you're the one that asked me to do it because I've done it with you for a few years now, and you're like, how do you know this stuff? I'm like, well, I just learned it from Jamie and her sister, Lisa. So I'm excited to share.
So we have a little poll over here for you guys to answer. If you're listening to us on Facebook, you won't be able to get to it. So I'll read the questions to you. The first one: when faced with a challenge, what is your first thought? Number 1, I'll never figure this out. Or A. B, I'll give it a try, but I'm not confident. Or C, this is hard, but I can learn. Number 2, how do you respond to opportunities outside your comfort zone? Letter A, avoid them. I might fail. B, consider them but hesitate to act. Or C, take the leap and learn as I go. Number 3, which statement resonates most with you? I am defined by my past mistakes. I am unsure if I can change, but I would like to try. And the last one is my past does not define my future. That's where we want everybody to be. What belief often stops you from taking action is the last question. I'm not good enough is something that's constantly in some people's heads, right? I don't have the resources, or no, I don't have any limiting beliefs. I can't grow anywhere else in my life. So thank you for answering those. These are some of the things we're going to be talking about during the retreat. It's funny, whenever I'm having a hard time, sometimes Tamara messages me. She's like, do you need any help? Do you want to do a quick call? Do you want me to hold space for you? And she just guides me through a couple of things that I have to do. And then I have a huge release and things just make sense. And I feel so much better. About 10 years ago, I started with family constellations. Has anybody here heard of family constellations? I started with that. And after that, I've taken tons of also mentorship opportunities. And recently, I was just, including this last week, I was in Orlando for 8 days straight, doing 8 different days of lectures, learning how to do emotional releases and all of this cool stuff. So I'm excited to be able to share everything that I've learned with you guys. And we will see you guys in April. Again, we only have a few spots. Oh, the discount. So for any dentist who wants to come, it is $2,500 for allied health professionals and $5,000 for dentists. However, the first 3 dentists who sign up, dentists or doctors, chiropractors, the first 3 doctors who sign up, Tamara, do you have the link? Tamara's going to put the link in the chat box, and I'll make sure to share on Facebook also. We are giving a $1,500 discount. So for the first 3 that sign up, you'll be $3,500 total. And the way that you pay also, it's not everything up front, guys. Usually you start with a $500 and then the payments is split into 2 months. The same thing for the allied health professionals. You pay $500 first, and then the payment is split into 2 payments, the rest. So anyways, we're trying to make this as easy as we can for you guys. We cannot wait to see you there. For many, many years, people have been asking me, so Renata, you're going to have a conference? Guess what? Area Circle is not doing a conference. However, we are going to be doing these retreats because, like Dr. Uma said, we feel like people are going to grow so much more in a different way in intimate settings like this. Dr. Uma, do you want to share anything else about what we talked about the retreat? Your thought around it? Oh, you're muted. We had such
I
good,
think you
great
already said everything. I'm myself excited because I've never attended something like this. I think, as I told you, I think we're just not talking about knowledge. It's about how to use the knowledge, how to learn from others, how to do things better. Trying to reinvent the wheel can take its own time. How you learn from others, and also I think me and you talked, Renata, the most important, how you help yourself first. Your mental well-being, your emotional well-being, psychological well-being is extremely critical for you to succeed. And being resilient and never give up attitude and ask for help is this is what all about. Otherwise, we can keep on learning. We can go into the webinar, sitting there, learning things. But it's extremely important to create an environment where learning becomes natural. And if you see the agenda, I think one thing I made it sure that there will be not very late night outs. We want you to get good sleep. You should like detoxified. You should feel more energetic when you leave there rather than exhausted like we feel in the conferences. So that was the goal about this conference. Retreat for that matter.
I just saw another sleep question that came in. So before we left, we're just going to answer that question. And this is going to be recorded. I'm going to be sharing this throughout the week so you guys can also share with your colleagues. If you have a friend they've been wanting to hang out with, you guys want to, come together for a little vacation / some CEs, dental CEs, come hang out with us. And if you're 2 people want to sign up together, if you're friends, send me a message. I might be able to do something better for you guys. For an adult with mild OSA using a mandibular advancement device, if managed to reduce AHI from 16 to 6. However, the N3 is still low, only 5% of whole sleep. What can be done?
So again, as I told you, there's a lot of things going on why the N3 is less. For example, if you do a sleep study, there is a condition called first night effect. That means if you're sleeping in an unfamiliar environment, your sleep pattern may be different than what you sleep at home. So a one night sleep study may not be a very accurate way of doing it. So hence there is more, home monitoring, EGs are coming, which I think will be very critical to understand your, rather than one night, over a week or 2 weeks, what percentage of your sleep on an average you're getting N3 sleep. So when I see that, I really don't jump and run to the conclusions unless the patient is having a lot of other issues. So sometimes we do this home monitoring EEGs for 48 hours to see if from back to back 2 nights they are low. And then if it is low, is it because of sleep apnea, or is it because of some medications, or is it because of some underlying conditions it is low about? So not all reduced N3 is necessarily because of N3 sleep. So either the sleep pattern is abnormal, or they're going to bed very late, or their sleep is not, very robust as it looks like. So sometimes I use melatonin, sometimes I use certain medications to increase the N3 sleep. There's a lot of different reasons why they have it. So it's extremely important to see them in the clinic, and rather than jumping to a conclusion is to actually step back and see, is it one night effect or is it really a problem?
All right. Well, thank you so much for sharing that with us. Guys, this has been a wonderful night. For everybody else on Airway Circle, we'll see you all Thursday at 8 p.m. That's our usual time. But we're excited to see everybody on this Tuesday, an extra night. Have a wonderful time. And enjoy the snow. It's trying to snow here in South Carolina. All the kids are excited. It's been 8 years, I think, since it snowed last. So everybody's awake with their gloves on, waiting for it to snow outside. And so far, just ice. Anyways, bye, everybody. Thank you so much. And we cannot wait to see y'all in April in Hilton Head Island. Mwah. Have a
Take
good
care.
night. Thank you, Dr.
Good night.
Hillman. Thanks, Dr. Harris. Thanks, Sam.